Okay, good morning, everybody. My name is Sabrina Madoff-Stepp, and this is Bethany Applebaum. And on behalf of our HHS Ignite team, we're really excited today to talk about the HRSA track team. TEAM stands for Time Engaged, Accomplishments Made. Here's our story, and we welcome you to join us. So we're the team that set out to prototype a new project management and communication methodology, what we're calling Track Team. Our vision for this was to approach a difference in saving time, money, and improving employees' perceptions of engagement. Of note, we started out thinking we were going to focus only on employee engagement, but like many of the Ignite teams, we've pivoted a few weeks into Ignite and saw an opportunity to align with saving time, money, and in other words, being more efficient. So let's look at this slide, communication overload. When you're working on a project team, communication is essential, and we have so many options on how to do this. Hundreds of emails, phone calls, texts, webinars, even memos on typewriters. Well, maybe not the typewriters anymore. But is it efficient? Are we saving money? Do we increase engagement? Probably not all the time. Here's a picture of an Outlook calendar. If you look at Tuesday, that person has probably got 15 meetings going on at once, and that's some multitasking. I don't know how they do it. So here's the pain. What's the result here? Just a lot of disengagement, jam-packed meetings, not the way to do it. And then if we look at cost, research shows that many employees have more than 60 meetings a month. 31 hours of those meetings are unproductive. The translation, $37 billion of money. So enter Track Team. We created a hybrid of two project management tools, huddles and Kanban boards. A huddle is where you gather around a table, a wall, a whiteboard, and your team does some updates together. And a Kanban. This is a strategy that was pioneered by the company Toyota, the car company. It means just in time. It's a system to improve and maintain a high level of production. So we put these two together. So what does this do? Teams agree to a meeting time, no more than about 15 minutes. You stand up and you use a Kanban board. And we're going to talk about that. So here's a simple template for a Kanban board. Kanban boards are a visual tool to track progress. Teams create columns of activities or tasks using sticky notes, and the goal is to move from the left to the right to show your progress and end up in that completed column. You can include as many columns as you want. You can label the columns however you want. It's really very flexible. So here's a picture of one board. This was a board for work requests. And here's a picture of another board. This was a board that focused on using deadlines to move projects forward. And then here's another board. This was a systems improvement board. As you can see from the previous examples, all of these team projects were very flexible in using the Kanban strategy. So here you have the first part of the story, and this is where we went next. We piloted Track Team with 4 teams over 3 months in HRSA's Bureau of Health Workforce. Here's what we found and our lessons learned. So originally, we started out to prototype this project management tool to save time, money, and improve employees' perceptions of engagement. Did we succeed? Yes. Was it perfect? No, but we learned so much. We did a focus group discussion with a sample of our user groups. The Track Team helped the boss make razor-sharp decisions. The Kanban piece of Track Team helped him cut out 2 hours of weekly meeting time. That's really a lot of time and savings that he can use for other activities. Track Team helped a team lead improve engagement with team members. There was a new feedback loop that took only 10 minutes. And then for a Track Team member, they understood better how to connect the dots. So a lot of lessons learned. We still need to learn how to engage teams, how to create those boards together. It's not a job for just one person to do together. We also know that Track Team is about iteration, it's about engagement, it's about dealing with all of those other issues that might sort of get people off the beaten path to go back and work those out, those roadblocks, on a separate time. So what's next for Track Team? We're really excited that we have buy-in from HRSA's Bureau of Health Workforce to continue to use Track Team after the Ignite program is over. We want to continue to get more buy-in. We want other leaders to see how important this is as a project management tool. It doesn't take a lot of time, but it sure improves saving time, money, and engagement. We want to do more demonstrations and collaborations with other team groups, and we want to see where Track Team fits. So here's the promise. We want to see how we can do this, engage employees efficiently to do their work, make a difference for the people who need their help, and help everyone at the same time. So here are some people that were very important to us in our project. There's many others, but we really appreciate it, and thank you.
So I got a quick question for you. So basically you're saying less dumb meetings, more quick, better conversations, right?
Yes.
That's a good thing, I think, for anybody out here. Right. You know, it strikes me, though, that, you know, this is something that lots of organizations have sort of picked up in various ways, shapes, and forms, both in the private sector and some in the public sector. What do you think are some of the barriers that prevent HHS from adopting these types of methodologies?
We had actually struggled to get teams to participate in our pilot, and one of our team members told his division that they would participate. And I think it comes down to people feeling like they don't have time to try something new, not wanting to, it's a matter of not wanting to take the time, not really wanting to explore something new, even though there's potential to save a lot of time in the long run. That doesn't outweigh the having to take time to focus on it now.
So do the data that you guys have generated over the first couple of months of testing this, is that helping to convince people that it's something worth trying?
We're hoping so. That's sort of the next phase of things. The HRSA Learning Institute, which is the internal training group at HRSA, has already talked about incorporating some of these methods into their management training courses that they offer. And so there might be some pickup there, but that's still in the developmental phases. We're really just starting to move it forward.
I've seen many variants of this kind of model, and where it really seems to fall apart, and I won't name names, but is when there's a micromanager or a non-sharer in the group. So you have the person who has to hold all the toys, and then you have the person who has to tell everybody how and when and where to use the toys. And then everybody else struggles as part of the team to work in that balance, if it's the manager, if it's a key team player. So how would this work differently? How would you propose overcoming some of those challenges?
So it was interesting. We did a focus group with some of the pilot participants, and the division director had asked, it was just an open discussion, and the division director asked one of the participants if she would feel comfortable doing this for her project, and she had actually at first said no, because I am just learning this whole new process. I don't know enough about the process. And through the course of our discussion, realized that she could put her board out in the office for everybody to see, and it would actually, then everybody could help her through the process, so she wouldn't have to figure it out by herself. And so I think overcoming it is just a matter of understanding the process, and understanding, I think, also that it's okay if it's not perfect the first time. I think people are very hesitant to have their work in progress on display in an open area of the office or out there for people to see. You know, we all work behind our computer screens and we show the final version to somebody. And so I think it's just a matter of shifting that thought process a little bit.
Yeah, this is really interesting, and I always love it when sort of software development practices expand outside into other sort of non-technology, non-software pieces. You mentioned sort of piloting it in 4 programs and talking to division directors. Do you see this as a top-down process where you convince leadership to use it and they get their teams on board? Or is it bottom-up where sort of the teams are overwhelmed with meetings and see this as a tool to help manage communication sort of up and down?
I think it can work both ways. I think if the manager sees that there is a management problem with his or her staff, then this could be suggested as something to use. But I also think that staff can take this and own it on their own. I mean, people have used these to plan weddings. One of the boards that we showed, one of the women had gone to a training and was thinking about how she could better organize the office priorities, and there was a 2-year backlog of things that were on the to-do list, and she put them on this board, and it's like, whoa, now we know exactly what we need to do when and in what order, and they're starting to make progress on that backlog. And so I think it can really work both ways.
Oh, now it's got a question. We're out of time, but go for it.
So it's not so much a question, but one thing I would encourage you to do as a team, and I've looked at other Ignite teams over the course of the last 1 year, is I would say don't get so wedded to this product or this process that you've come up with, but look at yourselves more as catalysts for this larger movement around engagement and productivity, and ask yourselves how would you persist that beyond either your own terms or others that you want to co-opt into the movement. So the product is not really your end goal, but the philosophy behind the product is probably what should be your end goal. That's all.
Great.
Great, thank you.
Thank you.
Great comment. Thank you, guys.